Hi everyone, my name is Jenn Verwers and I'm one of the co-owners here at Trifecta Physical Therapy, and I just wanted to take a moment to say hello, tell you a little bit about myself, why I got into physical therapy, and why we do things the way we do around here. I knew I wanted to be a PT since high school. I grew up in a family that was in healthcare, and my dad was a physician and my mom was a nurse, and I was able to watch them work with people and help people. And I wanted to do the same thing, but I was terrified of blood and needles, so PT was actually my default. But then I started shadowing and loved it. I also was really into sports and loved learning about the body and how we move and function. I spent most of my days in the pool and ended up swimming at Colorado State University and majored in sports medicine there. After I graduated, I went to physical therapy school at University of the Pacific in California. And when I came back to Colorado, I got a job downtown at a private outpatient ortho clinic. And at that time, reimbursement was really great. I was able to see all my patients for 45 minutes to an hour, and that lasted about 2 months. Blue Cross Blue Shield, United, and Cigna all had about 50% cuts in reimbursement. And then that cut, and then as well as other cuts that have happened over the last 14 years. Clinics like my old one have been forced to see 3 or 4 patients an hour. So for that model, I would typically be with the patient for 15 to 20 minutes and then hand them off to my aide, who is usually working with 3 or 4 other patients on exercises. About 10 years ago, I started treating people out of my house, very part-time, very on the side. And I slowly started to grow, and I realized that I was able to give people coming to my house better care solely because I was able to spend more time with them. Spending a full hour with someone allowed me to get to know them, what they wanted to get back to, and why they wanted to get back to it. It also allowed me to have a full hour to be hands-on with them, which allowed me to get them better quicker with less total visits and less frequency of visits. In my old clinic, I saw people 2 to 3 times a week, but at home I was able to get the same results 1 time a week. So as a manual therapist, I realized that this is the only way to be able to provide the hands-on treatment and the care that I wanted to give people. At the very same time, Danielle and Sarah wanted to do the exact same thing, and so we decided to take the plunge and start Trifecta Physical Therapy. I have never wanted to